Well, I just think that Signature Healthcare, having a full-time chaplain, shows the care they have for their resident. And I was drawn to the company because one of the pillars of Signature Healthcare is a spiritual element. And being a pastor for 25 years, it attracted me that it's more than making money. It is communicating and partnering with other departments to show the spirituality and concern they have for their residents. Some of the services that we provide as a chaplain for our facility there in Rockcastle is meeting the needs spiritually to the individual. Our quality of life department does a wonderful job of having approximately 30 church services or opportunities throughout the month. So what I do as a chaplain is meet those residents individually, to read scripture with them, to pray with them, and to show kindness and love to them in a unique way. So the services I provide is to be one-on-one with them. If a resident's in their families, the families go through a lot, bringing someone into the facility, and I want to be there for them to help them with their spiritual needs, and also connect them back to their churches and to their pastors. A typical day at our facility is one of beginning meetings to understand and know the needs of the residents for that day. Maybe there's been a situation that's happened the day before, so we meet and we talk about that. And then I go onto the floor and I meet those residents and go room to room and just have time of prayer. Sometimes it's just laughter, extending friendship and encouragement to them. And that's pretty much throughout the day. And we partner with other departments in the facility. If there's a resident that needs encouragement in the therapy room, then we go down and we're there with them at therapy. If quality of life needs someone to help push a wheelchair, we're there to help them with that. And we want to partner with all facility representatives to do what we can to help them to fulfill our mission at Rockcastle. Bereavement is a part of our occupation that is difficult. But we want to extend that and to help families go through a very rough time. And it might be from the very start of the time that they come in the facility, dealing with guilt and dealing with those issues. The spiritual department comes alongside them and helps them. And when that time comes, when death occurs, to be there as a friend. And many families look at you as part of their family. And not only to be there through the time of the funeral and when we celebrate life, but to also to extend compassion for them after that loved one has gone. We want to try to meet their need through those difficult times of life. Rockcastle County is unique in the sense that everyone is connected. The families love one another and they take care of one another in the community. And one way that we can try to help, we have a program called Reconnect, We take the residents of our facility and take them back to their home church, their home family, so that they can worship. It might be one more time. It might be the last time they ever participate in worship in their home church. But it's to help them with their quality of life, to reconnect them. And the churches come alongside us, and they're exciting. They give standing ovations when they enter their facility. And it's a way for us at Rockcastle Rehab to reconnect our residents back to their family and back to their churches. Another way that we have an outreach in our community, we developed a community senior choir where we go and we bring senior citizens from all over the county to come and to sing and to fellowship. Just one other way that we can reconnect with our family and our county. And so many times there's folks that's just, they may have missed that. And so we try to reconnect them any way that we can to show the love that we have for our residents and reconnect them back to the people that love them. I'm really proud of our volunteer program at Rockcastle County, and we want to try to encourage folks to come in. And we have folks from churches and in the community that come in, and they may push a wheelchair as we take residents to Walmart for a time of fellowship together. But our churches really respond, and it's a part of our service core where we want to have our community come and to volunteer to help us give quality of life for our residents.